Well, Laila Barhoum is Oxfam's Policy, Advocacy and Communications Manager and joins me now live from Erbil in Iraq. Thank you very much indeed for joining us. Laila, let's pick up on what we've just heard. Premature babies struggling in several hospitals in Gaza. It is, I suppose, the sad truth that in conflict situations, it's often the most vulnerable who are most at risk.
Indeed, and we have seen how this has impacted many aspects in the lives of Palestinians. We have to remember that the health sector has also been weakened and not functioning for the last 16 years because of the blockade. What we have seen now is an extreme case of people not able to receive health care. And these premature babies, we have received news from local media that 3 of them has died from a Shifa hospital. And this is devastating for the babies and for the mothers who should be celebrating life rather than grieving the death of their children. What is happening now is that hospitals are unable to provide services. We are seeing people on the floor. There are no beds, there are no medicine. And what is happening is that civilians once again are paying the prices for the conflict and paying the prices even more than any other round of aggressions that took place in Gaza. And meanwhile, airstrikes continue in Gaza, even now with the lack of communication. Some voices of Gaza coming saying airstrikes continues. Hospitals cannot receive wounded people anymore.
The heads of several United Nations organizations and other humanitarian organizations have said that they would not support or take part in the establishment of so-called safe zones in Gaza that are declared by only one side of this conflict. Would you stand by that assessment?
Palestinians should be safe in Gaza regardless. What needs to be done is that all civilians should be protected. So Gaza should be safe from any conflict that might affect civilians. In that sense, the priority is given to make sure that Gaza is safe once again for all civilians in all areas, and make sure that the priority is given to areas that has been affected by the conflict and airstrikes, especially civilian establishment that is sheltering displaced people. In that sense, everyone should be feeling safe in Gaza. It should be, what is happening now should be stopping immediately with ceasefire.
Yeah, and clearly your organisation and many others are very frustrated, of course, with the inability to get aid in to Gaza. It's all there on the Egyptian side, but they can't get it in. They can't get access to that. We also know that people have been told to move south in Gaza for their own safety. But just today, leaflets have been dropped by the Israeli military warning those people to move elsewhere. What's your understanding of how difficult conditions are in the south and where people might be able to go?
While there has been orders for people and they were forced to evacuate from the north to the south, claiming that the south would be more safe, we have seen day after day for the last 40 days that there isn't a single safe area in Gaza. While people were moving from the north to the south was being hit. Until now, there are hits. I've just received news from family members that Rafah, which is far south, is affected by airstrikes. And we also saw from local media, and some families were sending messages saying that they have seen these leaflets and they have already left north to the south. And now they have nowhere to go. The shelters are crowded. There are no apartments to be rented, and people simply don't know where to go. They are trapped. They feel unprotected as they are unprotected, and they don't know. Literally, they are lacking options, and they are running out of time as well because the airstrikes continue, and there is no opportunity for them to find any safe area.
Okay, Laila, we really thank you indeed for joining us. Thanks for giving us your analysis of what is an extremely difficult situation for everybody in Gaza. Laila Barhoum there joining us from Erbil in Iraq.